We are back with double board certified dermatologist Dr. Weston, who's here to share trending cosmetic procedures that can turn back the hands of time. Thanks for sticking around.
Of course. Thanks, Gail.
So, of course, there's the first one that so many of us love, and that's neurotoxins like Botox and Dysport.
Yes, exactly. So neurotoxin is the great way to put it. You know, Botox is a brand name, kind of like how Kleenex is the name for tissues. So our muscles and our face move. When we raise our forehead, our eyebrows raise. Well, that creates wrinkles in our skin. And so what neurotoxins do is targetively paralyze those muscles. They tell our muscles to contract less. If they contract less, then the wrinkles get softer. And over time, they can eventually go away. So when you're doing neurotoxins, it's a fine balance between selectively paralyzing the muscles, but still giving enough that you can make your facial expressions.
Now, what about facial fillers? Because, you know, I think a lot of women are starting to look a little bit like pincushions, getting too much. So how do you find that balance?
That is a great question and a great point that you bring up. You know, we talked about how women, as they age, they lose the structure of your face. And so what a filler is could be different materials, hyaluronic acid, but the goal is to rebuild the structure. Now, when you do filler, you need to be careful that you're placing it in the right spots. It can help rebuild structure over bone, and I think in the very appropriate areas, in a very select amount, it works really well. The problem is if you do too much of it, the thought was filler isn't permanent. Well, studies are showing now that it might be permanent, and so it's staying in your face and building up over time. Filler also attracts water. That's how it gives you volume. So if you put it in the wrong places, like possibly under your eye, it attracts more water than you wanted, which can give you a puffier look as opposed to a sleek look that you were looking for.
So you really need to go to someone who knows what they're doing when it comes to this, because it's like a work of art. We're talking about your face.
Exactly. When it comes to cosmetics, it's definitely a blend of art and science. You know, it's the science of understanding the anatomy, but the art of knowing exactly how much and where to place it to give you a natural appearance. You know, my goal is to keep you, not to have you look different, but to keep you beautiful, just looking more refreshed.
All right, we talked about this a little bit earlier in the last segment. You touched a little bit on microneedling, peels, lasers. What's hot when it comes to skin resurfacing?
Microneedling has made a comeback. You know, microneedling was an older technique, and it's come back. Why? Because it's proven. You know, skin injury is how we build more collagen. Well, microneedling, for example, is a device, has microneedles in it. We put it all over your face, and it creates tiny injuries. Not big enough to leave you scarred or that we can see, but enough to stimulate the collagen production in your body. What this does is helps with pore size, fine lines, and in the integrity of your skin. Chemical peels and lasers do the same thing. There's all different kinds of lasers, but essentially what a laser is doing is creating injuries in your skin to have your body create new collagen to create new skin. And that is the best way to give you a refresh, to fix sun damage, fine lines, dyspigmentation, and really an overall reset of your skin.
All right, well, listen, congratulations on your new office that just opened across the bridge. I saw all the ribbon cutting and all the celebration happening on social media. And we really appreciate you taking time out of your busy schedule to hop across the bay to the Bloom studio.
It's a pleasure. Thanks for having me.
Absolutely. And we're going to share Dr. Wall's advice on Bloom Tampa Bay. And don't go anywhere. We'll be back with more Bloom right after this.